Alrighty, we're going to review our confidentiality reminder. Please refrain from using the name of your loved one. Do not name specific facilities. Please use a nursing home or the personal care home to present to the group. If you need specific assistance, please use the chat feature to state which county you are in, and we will get you connected to your assigned ombudsman. And a reminder that these calls have public access and are designed for family members and friends of long-term care facilities. We'll review our meeting agenda. So we're going to get our virtual meeting tips from Eliza. Then we'll turn it over to Jess Lippert for our APPRISE program update. And then we're going to do a visitation guidance review. We're going to review the CMS guidance that was released on March 10th. And then we're going to review our upcoming meeting topics. So without further ado, I'm going to turn it over to Eliza to get our virtual meeting tips.
Hi, everyone. You all have been placed upon mute into entry of the meeting tonight. We will open the lines in a little bit so that you are able to share and ask questions. If you'd like to speak, or if you have a question, if you could use the raise hand feature. Once you do raise your hand, we will acknowledge you and we'll unmute your line so that you'll be able to ask your questions. If you hover over your mouse near the bottom of your screen, you'll see the participants pane. You can expand that if you'd like to see who all is in the call with us tonight. The chat feature is at the bottom of your screen as well. Once you maximize that, you'll be able to chat with the presenters and ask questions during the meeting as well. Closed captioning is available during this call. If you press the CC button at the bottom of your screen, you'll be able to use the closed captioning. If you need to step away for any reason, we ask that you hit the stop sharing button on the camera icon, which is located at the bottom of your screen. You can click on that once you come back to the computer. Any concerns or complaints can be directed to the State Ombudsman's Office at 717-783-8975, or you can email us at ltc-ombudsman@pa.gov. And it is my great honor and privilege to introduce my former coordinator, Jessica Lippert. Just as an introduction, she has worked in the aging field for 21 years. She has been in the APPRISE program for the last 16 years in various different roles within that program. She's also worked in other programs in the aging program. She's been involved with senior employment. She's done home delivered meals. She's done senior centers and the senior corps programs. So it is a great honor to introduce my personal friend, Jessica.
Thank you, Eliza. And that was a nice introduction. I appreciate that. So I want to make sure I'm good. Everybody can hear me. I know sometimes it's a little challenging when we're virtual. And Jamie's going to be running my slides today, so I thank her for that as well. And I would like to thank you all for inviting me here today to speak to you about the APPRISE program. I'm going to talk a little bit about our services, and I'm going to go into 3 assistance programs that can help Medicare beneficiaries save money. So we'll talk about the Extra Help program, the Medicare Savings programs, and we'll talk about PACE. So I'm going to have Jamie flip my slide. So we'll start today with just a very general overview of our APPRISE program. And I'm ready. There you go. So what is APPRISE? And APPRISE is the name of Pennsylvania's State Health Insurance Assistance Program, otherwise known as a SHIP program. And I emphasize Pennsylvania because these programs are established in all states across the country. So if you have friends or family members that live in a different state, they also have a SHIP program available to them that will provide the same services that I talk about today for us here in Pennsylvania. Now, the program itself has been in existence for over 30 years, and the secretary of the Department of Aging at the time of the program's creation was the one that determined the name. So in Pennsylvania, we call our SHIP program APPRISE. And I often get asked many, many times, what does APPRISE stand for? Because we do write it in all capital letters when we refer to our program. So oftentimes people think it is an acronym, but it's actually just the word APPRISE, which means to keep people informed. Now, our program is largely federally funded, but we also receive some funding from the Pennsylvania Lottery as well. And to ensure that our services are available to all Medicare beneficiaries across the state, the funding goes from the Department of Aging down to our area agencies on aging to deliver the APPRISE services to their communities. Now, we do have APPRISE staff working in our area agencies on aging, but we're also supported by volunteers. And we have over 500 volunteers statewide that contribute their time and their talents to our program. And we are so appreciative of our volunteers and their dedication to our program. Now, our APPRISE program's mission, it's pretty straightforward. It's what's on the screen. We are here to empower, to educate, and assist Medicare eligible individuals, their families, and their caregivers through objective outreach, counseling, and training to make informed health insurance decisions that can optimize access to care and to benefits. So to better understand the role of the APPRISE program, it's helpful to know that our services are provided under three broad areas. The first area is health insurance counseling, and this is our primary function. We help Medicare beneficiaries understand Medicare and their Medicare healthcare options and their choices. The second is community education. So in addition to that individualized counseling that we can provide, we also do a great deal of work to try to increase public awareness about our APPRISE services through community education, like what we're doing here today. And then our third approach is through outreach. And we often hear that the APPRISE program is one of the best kept secrets out there, but we really want to try to change that. There are still so many Medicare beneficiaries that do not know about our program. So therefore, outreach is critical if we are to reach those who need our services the most. And here's just a quick statistic for you. I always like this statistic because I think it kind of shocks people a little bit. We have our services out there and available to individuals. And again, I'm saying nobody, or a lot of people don't know about our services until they, are truly approaching Medicare eligibility. But you would be surprised. And I guess it'd be a question for you guys, but I'll give you the answer since you're all on mute. There are 10,000 people a day becoming Medicare eligible in the United States from now until it's about 2036. So you can imagine if 10,000 people are becoming eligible every day, our services are going to be needed more and more, as we continue, and a lot of our baby boomers are reaching Medicare eligibility. So people often ask us as well, who seeks out your services? Who needs the APPRISE services in Pennsylvania? Well, for the most part, individuals who are becoming eligible for Medicare, and of course, current Medicare beneficiaries seek out our APPRISE services. And these can be Medicare beneficiaries who are on Medicare due to their age, or we have a lot of Medicare beneficiaries out there that are on Medicare due to disability, and we provide the same services for anybody on Medicare, regardless of their age in Pennsylvania. We also provide assistance to dual eligible individuals, and those are individuals who are both eligible for Medicare and Medicaid at the same time. And then in addition, we do get a lot of inquiries from family members or caregivers who they'll contact our program seeking help for their loved ones, usually when they run into a problem or have a situation that they're having difficulty getting resolved. So we do help anybody out there who is Medicare eligible, again, here in Pennsylvania. Most people are familiar with our busiest time of the year, and that is the Medicare annual open enrollment period, which runs from October 15th to December 7th each year. And that's the time when you guys are watching TV in the fall and all you hear is Medicare commercials when you're watching TV. That's our busiest time of the year as well, because that's when we are able to help people switch plans for the following year. However, we do thousands of counseling sessions and plan comparisons throughout the year, of course, beyond that Medicare annual open enrollment period. And what we do is we provide free, unbiased, personalized counseling by trained counselors on original Medicare. We can counsel on Medicare supplements, which are also known as Medigap policies. We can help people with Medicare Advantage plans, and of course, Part D prescription drug plans, just to name a few. But in addition to providing that unbiased information, when a beneficiary selects a health plan like a Part D plan or a Medicare Advantage plan, our APPRISE counselors can also help them with their enrollment into that particular plan. We can actually do that enrollment for them over the computer. We can also explain to them the complexities of Medicare and health insurance, as well as address any issues they may have in relation to what's known as coordination of benefits. And that would be something like if I had Medicare and an employer plan at the same time, how would they work together? Or if I had Medicare and TRICARE for Life, which is a military benefit, how they would work together. Or of course, Medicare and Medicaid and how they would work together. And then finally, if a beneficiary does not agree with a decision from Medicare on their health plan or their other health plan, like a Medicare Advantage plan, we can work with them and provide them some guidance on how to appeal those decisions, hoping that, of course, they would get a favorable decision if they did do an appeal. But one more thing that our program does, which I think is very, very important, is that we provide application assistance with a lot of Medicare related public programs. So those would be things like PACE and PACENet here in Pennsylvania, the Extra Help program, and the Medicare Savings program. And I will talk about those programs in a few minutes. So now that you know a little bit about the APPRISE program, let me explain how our services are delivered to the community. So as I mentioned earlier, APPRISE services are typically delivered through our local area agency on aging, but in some counties, the area agency on aging has chosen to subcontract our APPRISE program to another local agency or entity in their community. But regardless of who hosts our program, all of the services are delivered in the same manner. So each local program does provide face-to-face counseling. And I'm going to say outside of COVID times, in our normal times, we do face-to-face counseling. Right now, that's not happening as much, of course, because of the COVID guidelines. But we also do telephone counseling. And we've even done counseling by email for some individuals who would like to do it that way. During COVID times, however, we did have to, of course, shift like everybody else. And many of our local programs moved to doing or incorporating virtual counseling as well through Zoom like we're on today, or Microsoft Teams, or WebEx, or a different virtual platform for those Medicare beneficiaries that were interested in having their counseling done that way. Now, I will say for optimal service with our program, I would recommend if somebody does want that assistance that they call their local program and make an appointment, because we want to make sure that our counselors have enough time, of course, to devote specifically to you or your family member or whoever it may be for their counseling purposes. However, if there's an emergency or something occurs, our programs do take walk-ins or, of course, drop-in calls, and we can arrange for counseling at that point. Now, in addition to our counseling services that we do at the local level, we also operate a hotline that can serve as a point of contact or referral for our Medicare beneficiaries here in Pennsylvania. And our hotline, and the number is going to be at the end of the presentation as well, but our hotline number is 1-800-783-7067, and we operate that Monday through Friday from 9 to 4. But a quick tip on your Medicare and You handbook that you receive each year if you're a Medicare beneficiary in the fall, on the back of it, if you flip it over, our telephone number is right on the back. So it's easy to see, easy to find. And that number is posted on a lot of our materials as well. But our hotline provides basic Medicare information. You're not going to get a whole full-blown counseling session on our hotline. It's primarily there to kind of help guide the individual to their local program for some more in-depth counseling assistance. And when a beneficiary either calls or they come into our local program for assistance, our APPRISE counselors, of course, will do the Medicare counseling portion of it, but they also may become aware of some other services or needs outside of our Medicare scope of service. So our counselors can provide a referral to other agencies, or a lot of times they can provide a referral to a different department within their own agency for services such as assistance with applications for things like LIHEAP or SNAP benefits. So before I move on to our assistance programs, just any quick questions you may have about our program in general. I see one popped up there, huh?
we do have a question in the chat.
Okay.
And it says that it's from Chris. And this person's mom is dual eligible and already is in a skilled nursing home. She's on Medicaid and also has an AARP supplemental insurance. Is the supplemental cost needed with Medicaid, or is there a better option in Pennsylvania?
So that's a very personal question. They're very specific to this individual. And I would actually, if you don't mind, because it is very specific, if you guys would like to email me that person's name and contact number so we can get in contact with them and kind of talk that through, if that's okay.
Okay. I don't see any other questions so far.
Okay. And I'm only saying that, Chris, because we could go into probably 2 hours of discussing that. So we can get you that information and get you to somebody to discuss that situation. All right. So I will move on to talk about assistance programs and what's out there and available to our residents in Pennsylvania. And a few of them are, of course, are also available to people outside of Pennsylvania as well. But as I mentioned earlier, one of our primary duties is to screen and assist Medicare beneficiaries with applications for these programs, because our goal is to try to help save Medicare beneficiaries money on their prescription drugs, and if we can, help save them some money on their Medicare costs as well. So let's dig into some of these assistance programs. So we are going to start with the first program here. And I know it sounds like a funny name, but it's called Extra Help. So the Extra Help program is also known as the Low Income Subsidy Program, and it's administered by the Social Security Administration, and it's connected with Medicare Part D, D as in dog, which is the prescription drug portion of Medicare. So if an individual qualifies for this Extra Help program, their Part D premium and their Part D deductible will be greatly reduced or eliminated, depending on where they fall into the extra help benefit. They will also see lower, more manageable prescription drug copays, with potentially, depending on if the person resides in a long-term care facility or if they're on a waiver program, those costs may even be eliminated for them. So qualifying for the extra help program will also eliminate the coverage gap that is in our Part D plans and any Part D late enrollment penalties that the person may potentially have from previous years. Social Security, on their website, if you look on there, they estimate that extra help, if somebody receives the full benefit, it's worth about $5,000 a year. And that's just an average on the estimate, which again, it's a great savings for a lot of people, and it can really help reduce those drug costs. Now, Medicare beneficiaries already receiving Medicaid benefits. So if I already have Medicaid benefits, I will automatically get extra help. They're kind of tied together, tagged together. So if I get Medicaid, extra help just comes along with that. If I do not have Medicaid benefits, then I would need to apply for this program through Social Security. And a beneficiary, if they want to do this themselves, or their caregiver wants to do it for them, they can apply online at Social Security's website, which is ssa.gov, or they can call Social Security and request a paper application, or they can come to our program and we can assist with the whole application process as well. I will say this application is pretty simple to complete, whether you do it online or paper or we're assisting you with it, because there's no verification information that you need to attach to the actual application. It's just submitted, and if Social Security needs anything additionally later on, they can ask the Medicare beneficiary for that information. But usually, and as long as I've been doing this, is very rarely does anybody get contacted for additional information with their application. Now, Social Security does not have a specific time frame when they process these applications. However, if the applications are submitted through their website, they of course are processed a lot faster than if they come through a paper application. We're seeing about 3 to 4 weeks is the general application processing time. And once that application is processed by Social Security, the beneficiary themselves will receive a letter in the mail, a written decision, and it's a notice from Social Security that says whether you received the benefit or if you didn't. And if you did receive the benefit, it will give the exact details about the start date of when your extra help is going to occur and the subsidy level that you are going to be receiving. So you can either receive full extra help or you can receive partial extra help at different percentage levels. Again, we're here to assist anybody through this process. You can, contact our program and say, I'm interested in finding out more about this. And, we can guide you through that and again, help with that actual application. So of course, the next question is, how does somebody actually qualify for the extra help benefit? So first, they must have, in my little Medicare, I see my E jumped off and my green box is dropped down there. But first, they must have Medicare or be eligible for Medicare. They can be enrolled in Medicare Parts A and or Part B. So you actually only need to have one part of Medicare to apply for this benefit. Now, in general, most of the people we do see have both A and B of Medicare. Second, they must meet the income and resource guidelines unless they already have Medicaid. And then finally, of course, they must apply for the benefit if they don't have Medicaid already. So we'll take a look on the next slide at the income guidelines here. And the income guidelines I have on the screen are actually the highest possible income and resource guidelines for an individual in 2021. And I say highest possible income guidelines because we actually include the most common income and resource disregards in here as well that the vast majority of people qualify for. So you can see it's broken down by single and married individuals on here. And if somebody, again, is even close to these guidelines, we always say, when in doubt, fill it out. The worst they can say is, no, you don't qualify. But we've always, you know, at least we're giving it a shot to see if potentially you may be eligible for a benefit, because there are other income and resource disregards that aren't as common that maybe somebody might fall into a category of being eligible because of one of those disregards. And these change every year. So if you're close and you don't get it this year, maybe you might qualify next year. So the next program we're going to talk about is the Medicare Savings Programs. And these are also known, you'll hear people call them MSPs, or if you're talking to the county assistance office, they call it the buy-in. So there's lots of different terms, unfortunately, for the same program. We just kind of have to navigate those. So the Medicare savings programs are administered by the Department of Human Services with the eligibility determined by the county assistance office. The Medicare savings programs are a Medicaid benefit that's associated primarily with Medicare Part B, as in boy. So if an individual qualifies for the benefit, the state will pay their Medicare Part B premium, and it will no longer be deducted from that individual's Social Security check. Medicare beneficiaries with the lowest income and resource guidelines may also get assistance with their Medicare deductibles and cost sharing. And if they are, again, at the lowest possible level of this program, they may also receive full Medicaid benefits. So a beneficiary interested in this program can apply, again, online, of course, at the Compass website. Or there is a paper application available called the PA 600M, which actually stands for Medicare. So PA 600M is the paper version. This application, I wish I could say it was as simple as the extra help. This one is a little more detailed. And if you've ever had to do an application with the county assistance office, you probably know that it does require backup documentation. So this would require that as well. So the beneficiary, once they file that application, would have to provide that backup documentation. Otherwise, it's not going to be processed. Now, the application will provide guidance on the types of information that is required, but the most common items are things like proof of residency, proof of income, and proof of resources. But once that application is complete and submitted with that backup documentation, the county assistance office will process the application between 30 and 45 days is what they have to do that application review. And the beneficiary would receive a written notice from the county assistance office as to whether they qualify or not, and if they do qualify, what they're going to actually be qualifying for. If the beneficiary was approved for these benefits, it can take 2 to 3 months before, I'm going to say, they start to kick in, and that dollar amount that is for their Medicare Part B premium, it takes a few months for that to stop coming out of their Social Security check. But once that occurs and the state starts paying the premium, it can be retroactive, and then the individual would get up to 3 months back of that Part B premium deposited back into their bank account, or however they are receiving their Social Security benefits. So again, how to qualify: the beneficiary must be enrolled or entitled to Medicare, must meet the income and resource guidelines, and complete and submit that application with the backup documents. So the income and resource guidelines are here on the next slide. And this is for 2021. And you can see again, they have single and married, and we did use the maximum, the highest level income and resource guidelines out there with the most common disregards applied. And the last program we're going to talk about here today is only for people in Pennsylvania. It's the PACE and PACE Net program, and we're lucky to have this program in Pennsylvania. So PACE is Pennsylvania's prescription assistance program for older adults. You have to be age 65 or older, and it's funded through the Pennsylvania Lottery. And the great thing about this program, that unlike other assistance programs like the last two we just looked at, PACE only looks at income. They actually do not look at resources. So if an individual qualifies for PACE, they will be able to obtain their prescription medications at a lower cost. And PACE itself is actually broken into two categories. It's broken into PACE and PACE Net. PACE has the lower income guideline, while PACE Net has a more moderate income guideline. You can have PACE along with a Part D plan, and many PACE card holders also qualify for extra help or one of the Medicare savings programs. The one thing you can't do with PACE is you cannot have PACE and full Medicaid benefits. So to qualify for PACE, of course, you must be a Pennsylvania resident for at least 90 days, age 65 or older, and meet those income guidelines. Now, to apply for PACE, an individual can call the PACE hotline. And again, the number will be at the end of the presentation. There's actually an online application as well, or you can do a paper application. Now, I will say the processing of PACE applications is really, really quick. We've had people apply for PACE and get the application in, and they hear back from PACE in like 3 business days. So it's really, really fast. And I would recommend, if somebody needs the benefit quickly, to either do it online or by calling their phone number to get it processed again really, really fast. And if somebody is denied, they'll also receive that notice in the mail. So you can see here are the income guidelines. And again, it's just income because there are no resource guidelines with the PACE program. So you can see it's broken down. PACE is at the top, PACE Net is at the bottom. And these income guidelines very rarely change. The last time it changed was probably about 3 years ago. They increased the PACE Net income guidelines to where they are right now. So they are fairly moderate. So for example, a married couple can make up to $35,500 a year and qualify for this particular program. So the PACE, I just saw a chat in there, the PACE income guidelines are on your screen, but I can repeat those again if you would like me to out loud as a question on the chat there. So the PACE guidelines are that you have to be a Pennsylvania resident for 90 days, age 65 or older, and meet the income guidelines, which are, as a single person, and I'll give you the highest possible. So as a single person, you can make up to $27,500 a year. As a married couple, you can make up to $35,500 a year.
Excuse me,
Yes.
we also had a question in the chat, and that's probably what you mean by the income guidelines, but somebody was asking about the resource limits.
Okay, is that specifically for the other programs, or I'm just looking in here?
To qualify for PACE program, to take into account married couples if the consumer is married. I'm not sure what the message is exactly. I'm not sure.
Sure. So PACE does not.
She's wondering under the MSP, what do you mean by resource limit?
Sure. So the Medicare savings program, they call them resources. So those are things like checking accounts, savings accounts, money that you have on hand at home, certificates of deposit, so CDs, stocks, bonds, mutual funds, 401ks, life insurance policies, real estate that's not your primary residence. Those types of things are what they consider to be resources. So I'm going to say the quickest way to say that is something that you could turn into cash or liquidate in a short period of time there. I hope that answers the question.
I think it must have, because I don't see any more in the chat.
Okay.
Thank you.
Well, you can type in some more in the chat if you need to, but I do have some contact information for some programs that may be important to you. So I do have on here our APPRISE hotline and the number. And again, please feel free to call our hotline. You can call it if you have a Medicare question, or you can call it if you just want to find out where your local program is and it's easier to call us instead of going online. Again, feel free to call. I also have on here the link to Aging's website where you can find your local area agency on aging. And again, that's primarily where the majority of our APPRISE programs are located. And then on the next slide, I just added a few other, I'm going to say important, at least I think they're important, contacts or resources. So I have on here Social Security, Medicare, because I know everybody always says it's 1-800-Medicare, but sometimes you have to think about what numbers you have to press on the phone to do 1-800-Medicare. So the actual numbers are on there. We have our Pennsylvania Department of Human Services and the aging phone number, as well as the PACE-PACEnet phone number and all of their website information. And Jamie just chatted to me. Can we send the PowerPoint out? For sure. Absolutely. I can actually send Jamie, I can send you a PDF version if you would like, because that's probably the easiest to get out to everybody. So yes, if you have questions, feel free to chat those in, or I guess you guys, if you want to have them ask live questions or raise their hand, we can do that as well. And if you ever think of any other questions after you're done and and we're off the call, again, feel free to contact our hotline, and they can either direct you to your local program or again, answer whatever question you may have. So I hope this was helpful to you guys and provided you with some information that either helps you, your family members, or if you have friends out there, or just people becoming newly eligible to Medicare. A lot of times they're just looking for a resource, and we're here to help.
Yeah, thank you so much. I learned a lot during that too.
Well, thank you.
Sometimes you think you know it, but then when you see it, it makes so much more sense.
And I'll send you that PDF version, and you can send it out. And if you guys can get me the information for Chris F., we can get in contact and take care of that.
Absolutely. Thank you so much.
All right. Thank you, guys.
All right. Now we're going to move over to our second portion. So if you want to enjoy your evening there, Jess, you don't have to join us for this part, but it's up to you.
All right. Well, you guys have a good night.
Thank you.
Mm-hmm.
All right. So we're going to review the latest CMS visitation guidance. I know this came out on March 10th. So we wanted to go through and talk about what the new additions are to our guidance. So I put together all of the changes since September when the initial ones came out. So their definition of fully vaccinated means more than 2 weeks following your last dose of the COVID vaccine. So if it's a single dose, it's just 2 weeks after you get that one. If it's a double dose, it's the second 2 weeks after your second dose. And then the clarification, this was kind of the big change, the indoor visitation. So facilities should be allowing the indoor visitations at all times, except, and these are the three examples that they gave. So unvaccinated residents, if nursing home COVID-19 county positivity rate is higher than 10% and less than 70% of the residents are fully vaccinated, then they can limit visitation. If a resident is confirmed COVID-19 infected, and then residents in quarantine, whether vaccinated or unvaccinated, until they have met the criteria to be released from quarantine. And one of the ones that they put in here, compassionate care visits should be permitted at all times. So that's regardless of an outbreak in the facility. So that was some really good information that CMS put in that latest review. More information. If a resident is fully vaccinated, they can choose to have close contact, that would be including touch, with their visitors while they're wearing a well-fitted face mask and performing hand hygiene before and after the visit. Indoor visitation can still occur during an outbreak. So if a new resident or staff case is detected, the facility should immediately begin outbreak testing. At least one round of that facility-wide, and then visitation can resume if there's no additional COVID cases in other areas of the facility, and visitation can resume in all those other areas. So if there's an additional case in that particular area or unit, then they can just quarantine that particular unit and still continue to have visitation. Okay. And this is one that was within the original guidance on September 17th. That CMS recommends that facilities should consider the number of visitors who are in the facility, the building itself. So the facility can consider scheduling visits or putting a specific time to ensure that all residents are able to receive their visitors. And during indoor visitation, facilities should limit the visitor movement throughout the facility. So we wouldn't want them walking around different hallways. They need to go straight to their loved one's room and not kind of spread that around. For situations where there's a roommate or their health status prevents them from leaving the room, facilities should attempt to enable in-room visitation while still adhering to the principles of COVID infection prevention. So, and we'll make sure we send all these slides out to everybody so you can have them for your review. So visitors should be notified about the potential for COVID exposure. So if there is an outbreak in the facility, there should be signage if you go to visit saying that we do have an outbreak, kind of informs you if, you want to go in only when it's COVID free so that you know what you're walking into. And while visitors, CMS encouraged them to be tested, and get their vaccine. They can help to spread prevent the spread of COVID-19, but visitors should not be required to be tested or vaccinated or show proof of such as a condition of visitation. So this was important information that was added in this new guidance. And as always, if you are having any difficulty understanding the guidance or obtaining visitation, please put your county in the chat area and we'll get that information for your local ombudsman to assist you with that. Okay. And now we're going to open this up for questions.
We do have something in the chat. Now let's see. They're having issues with phone calls. They have to contact the activity director who sets up a time, and it is Monday through Thursday from 9:30 to 12:30 for residents who need assistance. Now I lost what the second part it is. With the phone or Skype or Zoom. They have refused to set up times and dates in the evenings or weekends. So I don't think they're talking about visits per se, but even getting virtual visits, they're having problems, I guess.
And that would definitely be something to contact, the local ombudsman and try to, work with them to troubleshoot why particularly they might be doing that. Is it a staffing issue or, something that they can look into for alternate, troubleshooting on that.
And then we have a question. Do the cities follow the CMS guidelines or the guidelines set by the city health commissioners?
Usually they try to follow both as far as, my understanding. I know the press releases that followed shortly after the Department of Health, the CMS guidance, the day after, we had one from Department of Human Services stating that they strongly encourage facilities to follow the CMS guidance because they're aligning their policy with that. It hasn't been released yet, but we're really hoping to see some more on that shortly.
And Jamie, we have one more question. Can the residents leave the facility, and what are the requirements for returning?
They can. Okay. Let me double check some things here. There's more clear guidance for the Department of Human Services that I've noticed. They really have their outdoor visitation really written well. So I'm not sure if it's a nursing home or the personal care home that you're referring to, but you can do a visitations now. I'm trying to find out exactly what it says. Eliza, did you find anything on that one?
I can look for the guidance real quick.
Thank you.
Okay.
Well, Pam, oh, sorry, go ahead. I was just going to say Pamela Malonis has her hand up.
Hi, yes. I was recently granted compassionate caregiver status at my mother's nursing home. Her unit has not had one case of COVID on it since the whole thing started. My mother is fully vaccinated and I will be fully vaccinated. I get my second shot tomorrow. And so April 7th. My question is, when we go in, we need to put on a blue gown to see her, to go into her room and see her, as well as a face shield. And, of course, we always go in with our masks on. And my question is, if there's no outbreak, and we also must be tested weekly with the staff. It's required for us to have these visits. So I'm taking it they look at us now maybe as possibly employees since we're feeding her lunch. But my question is, there are other people from the outside like hospice, and they don't have the blue robes or the blue surgical gowns on. And I'm kind of not understanding, because I don't see any difference really.
Sure. Yeah. The guidance as far as CMS says is just a well-fitted mask. However, the facility, when they design their compassionate caregiver policy, they might have included that in that. So I'd want to ask the facility to see what their policy that they have, at their particular facility is.
Yes. And then we are also allowed to hold my mother's hand but we are not allowed to hug her or kiss her, even though we're in the full gown and we've sanitized our hands. And, you know, I'm thankful for everything I'm getting here, but I still feel like ultimately the nursing home, particularly the nurse manager, is having a problem relinquishing, you know, that overprotective, which God love her. I mean, she did a good job, but now it's time, you know, and so I'm not sure. Also, something I wanted to say to anybody else here, I requested directly from that nurse manager over the past year on 3 separate occasions to have these visits. I finally, the last time I requested verbally to her, she said, well, you're a sister and you only came in once a week, so you don't qualify for that. I then thought, well, I'm going to talk to social services, and we did indeed qualify it. Mom's on hospice for the 3rd time, and this is the final time. She can't really talk anymore, or, you know, so I'm very thankful for that. But I just wanted to let everybody know, please request it in writing. Please talk to social services or your ombudsman or whoever, and you not rely on, you know, like a nurse manager or whatever. So thank
Absolutely.
you.
And Pamela, with this new guidance, I mean, were they telling you you couldn't hug her before this was released, or is that since this has come out?
We couldn't see her before this was released. They only opened it up to us. We saw her over the past year. Actually, the first time she went on hospice, they moved her to another section of the building where we could go in and hug her, kiss her, no garb, no face shield, feed her, take her to the, you know, the cafeteria where really no one was. But so there's like a huge, she was under the care of another nurse manager when they moved her to the section. So you see where I'm going with this. There's definitely, I don't know what you'd call it, but yeah.
Yeah, that's like an
So we've only seen Mom 7 times in person. Only were able to touch her a year ago when she was on hospice the very first time, which she improved up to the unit. And I said, well, she improved because we were with her, you know what I mean? And she was still talking and herself, and now she is not herself anymore. But, you know, that's water under the bridge or whatever. But I'm just kind of curious because I'm not sure why. Oh, and then so we have these surgical gowns on that are supposed to keep our germs from getting on her, infection control. I worked at a hospital for 40 years, so I understand it. But then we're disposing them right into a trash can. So it makes no sense to me. You know, I'm not getting it.
Yeah, I mean, I would definitely, you know, when we provide the guidance to you, you know, take that in, because it specifically says, you know, that they're allowed to have touch if they have that fully vaccinated.
Right. And I will say one more thing. Okay, so Mom somehow sustained an injury to her hand. So not that she could put her mask on and take it off before, but she really, really can't now. And the nurse manager came in, and after we were done feeding her, put her mask back on her. And I don't want to say anything because, again, I'm very appreciative of all this, but I feel like there's a little bit of something else going on here because she shouldn't have to wear a mask. She's fully vaccinated, and we're dressed to the nines with PPE. So I'm not sure what the issue is, other than we can't see her face anymore and tell if she's smiling or whatever. So, but again, you know, we're very lucky. It took a lot of not understanding that we needed to not talk to the nurse manager, and we needed to more or less jump up to the next level, you know. So I don't know what to say, but yeah, it's a new process now. So I guess we'll figure out how it goes and just feel lucky for the time that we have, you know.
Absolutely. Thank you for sharing your story there, Pamela. We appreciate that.
Thank you. You guys have been a great help through all this. I'll tell you, you know, thank you very much.
You're welcome.
We do have some more questions or comments in the chat. Peg Laramie is wondering if there's any way to know the number of staff in a given facility who have tested positive and or if they have been vaccinated without knowing their names. HIPAA is often used as a reason not to give statistical information.
Well, according to the guidance, I mean, they're going to have to, you know, be able to tell you if it's a percentage. That doesn't say that, you know, I got my vaccine, but she didn't, you know, so don't stay away from her. You know, they're not going to give you those specifics, but according to the guidance, you know, you need to know if, you know, the majority of folks have received it to see which, you know, part of the guidance we're to follow. So that they shouldn't have any issues with that.
And we had a question similar from what before. May residents leave the facility and return without the 14-day quarantine?
I believe there's something. Did you find that? I'll let
I
Liza
couldn't
answer
find the
that.
exact wordage, but they are permitted to leave.
Yeah, they're wondering about the 14 days when they come back, though. I haven't seen anything specific in the guidance about that one just yet. I'm really hoping when they release it, they'll be very clear on that.
We have someone hoping that you're going to post on Facebook the CMS guidance, and I'm sure you're going to be doing that, Jamie, but
Yeah, it is up there. It's a little bit complicated how to find it, but we'll make sure when we send our follow-up email tomorrow morning, I'll have that attached.
Okay, we have another one. Our family member was in 6 weeks in a medical rehab for a stubborn urinary tract infection and has now been placed in a 14-day quarantine. He is not receiving the physical and therapy in his discharge instructions. So he's in a facility. He's been there 6 weeks, but he's sick with a urinary tract infection, and he's been placed in quarantine.
Okay, I can
now
speak.
He's not getting therapy.
Yeah, I can speak to that. I put that note. So I guess I'm asking, what is the rate, or it's sort of the juggling act between the COVID guidelines, you know, which is over everything, which is the quarantine. He's completed the 6 weeks medical rehab. He's clear. But in his discharge notes, he was supposed to continue skilled physical therapy and skilled occupational therapy because he has not regained the ambulation that he had when he was admitted to the hospital. He was very sick with an infection. So, of course, he's in a room for 2 weeks, not going out of the room. So he's not even getting the ordinary walking around the building he would get. So I'm planning to broach this topic to nursing tomorrow morning. I just had a chance to study his discharge notes today. So anyway, I don't know what to expect on that. The discharge notes also has a whole separate sentence. It says, resident may leave the facility for therapeutic purposes. So we'll see how much clout doctor's notes have over against CMS and COVID guidelines and all. So it's like a soap opera, isn't it? It's hilarious. So I mean, if it isn't hilarious, that's the worst part. But anyway, so you have, this will all be over sometimes. Is you know what we have to say.
Yeah, Peg, don't hesitate to reach out to your local ombudsman if you need some assistance or even want somebody to go into that meeting with you.
Yes, I did write her an email just before I joined this meeting. So I finally found her and she's been very helpful.
Glad to hear that. Thank you for sharing. Keep us posted. Hopefully it's all good. Okay. Anything else over there, Carol?
Oh, I'm not seeing anything else right now. No.
Okay. All right. Well, that's all that I have this evening. So let's review our upcoming meeting topics. Our next meeting is going to be April 6th. And then we're going to hear from Janice Minert. She's from the Pennsylvania Health Law Project. And then on April 20th, we're going to talk to the volunteer ombudsman. We're going to have a panel discussion since that's actually National Volunteer Week. So we're going to hear from our volunteer ombudsman and how to become a volunteer and just more information about that. And then you can see I put a little extra pizzazz on this one. On May 4th is actually our 1-year anniversary with the Virtual Family Council. So we're putting together a really nice panel of folks to talk to for that meeting. I'm not going to spill the beans until I get confirmation, but we're going to see a couple of repeat folks from way back in the beginning when we started. So we're pretty excited about that one. If anybody has any ideas that you'd like us to do, let me know. We can always add something to that meeting if anybody wants to see anything special for the 1-year anniversary. Okay. And as always, thank you for attending the meeting this evening. If you have any specific questions or concerns, please contact the State Ombudsman Office at 717-783-8975, or you can send Jay an email at ltc-ombudsman@pa.gov. So thanks for joining, everyone, and have a great evening.
Happy Easter, everybody.